The thing that comes to my mind when I think about 1-800-BAD-DRUG is an alarm that says medical alert, medical alert.
These 1-800-BAD-DRUG ads usually come on and they simply give you a really brisk message. You might die.
It seemed so overly dramatic. It was incredibly frustrating. Some of the things they said were incorrect or completely misleading.
I am routinely asked about 1-800-BAD-DRUG ads. This last week, I had a lady come in and ask me about the blood pressure medicine she had quit taking, and she said, "I can't take that drug, I saw it on TV." It's like, that's the measure? You saw it on TV? And that answer is, yeah, that was the measure. She quit.
I had a patient several years ago who came in already having been prescribed one of those medications and told me there was no way he was taking it. We talked about it for a while and I tried to talk him out of it. Found out that he had died from a recurrent clot.
It's hard to watch television without seeing some of these ads. It does prey on seniors because seniors are on a lot more drugs than young people.
What's not okay to me is when someone is told something that is not true and then makes a consequential decision based on false information.
It creates an unbalanced scenario where the conversation with your physician is based on science and based on what's best for you, and you get to be part of that. That doesn't go on the television.
It presents a false choice where the person who's watching the commercial believes that they can either take the medication and have a complication or not take the medication and be fine.
If you go into a movie theater and yell fire and you create a riot and people are harmed, you will be responsible. And if there is no fire and you made that up, you might go to jail. This is the equivalent of what 1-800-BAD-DRUG is allowed to do. With no science, they are allowed to yell fire in the theater.
Patients are torn between who to believe. We should be able to have an equal discussion where people advocate for patients and people say, hey, be careful about what you're going to take without being just flat out false. We can strike a balance and maybe make it more about patients and doing what's right for people sitting at home.